Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Nicole Cifra. She's an adolescent medicine physician. Her KevinMD article is titled The Surprising Impact of Medical Students on Patients. Nicole, welcome to the show.
Thank you so much for having me.
So we'll get into your article in a little bit. First off, briefly share your story and journey to where you are today.
Yeah, so I've always had a place in my heart for adolescents. And initially, I thought that when I went to medical school, I would be a primary care pediatrician that just didn't mind teenagers. And as I kind of progressed through my training, really as a medical student, I learned about the field of adolescent medicine as a subspecialty. And I really was drawn to it. I just love the people that I work with. I love my mentors. I feel like it's such a great, tight knit group of folks. And our patients and the impact that we can have on them and just being witness to their journey into adulthood is such a privilege. Specifically, my main area of interest, which has been a long-standing one, is eating disorders and malnutrition. And that comprises a lot of, actually, the majority of my clinical time.
So tell us some of the typical cases that you would see in adolescent medicine, and you specialize in eating disorders. So tell us some typical challenges that you would face, typical cases that you would see.
Mm-hmm. Yeah, so it's really interesting because I think that the COVID pandemic has really highlighted a lot of these issues and really increased our volume and the degree to which our patients are suffering as well. And so sometimes I practice in the inpatient and the outpatient setting. And so we work on a multidisciplinary team. I have a lot of great colleagues that I love working with, including dietitians and psychologists. And we see patients from, their initial assessment and making that diagnosis of an eating disorder and kind of helping educate families about that. And then kind of having them go through their journey and getting them back to life, which is a really cool part of my job. And so it's neat to kind of work in a few different settings and meet a lot of different people and help kids get back to their lives.
All right, your Kevin MD article is about the surprising impact of medical students on patients. Now, how did your article come together?
hmm So, as I was reflecting on my journey as a medical student, and then kind of as my view of medical students has changed after kind of graduating from that role, becoming a resident, then fellow, and now attending, I could really kind of reflect and appreciate about how my view has evolved of medical students. And I think it's so hard. I remember when I was a medical student feeling like what you did doesn't matter, that you were in the way or didn't have much value to add to the team. But as I've kind of stepped away from that role and I've worked with so many amazing medical students and learners of all levels, I've really come to appreciate what an impact medical students can have on patients and on their teams. And I think that it took me kind of stepping away from that role and seeing it from the outside perspective to really truly appreciate how much of an impact med students can have.
So, talk more about that evolution of your perspective from a medical student yourself through training, through fellowship, through attending. Tell us about the evolution of your perspective.
Yeah, so I think especially as a resident, I think as a resident you feel like you're being pulled in a lot of different
Yeah.
directions or doing, a million things. And sometimes it can feel it's a little bit sad in some ways because you feel like you don't have as much time to get to know your patients as you may want to because you just have so many tasks to
Yeah.
complete. And I remember as a resident, I really struggled with that. And I felt like I wasn't, as present for patients as I wanted to be.
Yeah.
And I found that the medical students on my team, I think I specifically mentioned one situation that really stuck out to me, really filled that role and like getting to know patients and learning from them, helping them feel heard and, walking with them through the process for, really on a in a time span and, an amount of time that just isn't feasible for residents or, attendees even. And I really came to appreciate that and see the value of that as a unique kind of offering on the healthcare team.
Now, for those who aren't familiar with how a typical teaching team works, what is the role of a medical student?
hmm So oftentimes medical students will kind of follow a few patients on the team. So depending on kind of the type of inpatient team that you're on, you can have between 12 to 20 patients, sometimes even more, I'm sure. And medical students will usually pick, three or four of those patients to follow, and those kind of become, the patients that they get to know the best. So they're not kind of following everyone on the team like residents or attendings maybe, but they really focus it on those few patients, present them on rounds, learn about their disease diagnoses and kind of medical history, and get to know them as people.
And when you talk to patients and they develop this deeper relationship with a medical student than they would with, say, the attending or fellow, what impact does that deeper relationship have on the patients on the wards?
Mhm. I think the biggest thing that I have noticed is that it gives them an opportunity to really kind of feel heard and process a lot of what they're going through. And I've been on teams where we've learned things about patients that have been kind of learned through really, long, deep conversations medical students have had with patients, and kind of building that rapport, and then patients kind of bringing things up that are helpful to know and may not have otherwise kind of come to the surface, but really help the team meet their needs in a better way.
So now that you're an attending and you've reflected back on that experience of when you were a medical student,
Mhm.
so what kind of role do medical students have on your team? Has the way you've taught medical students or interacted with medical students, has that also evolved over time?
Mhm. Yeah, and I think that kind of getting to the heart of my article, like you never know what can be brought up and to whom and how helpful that information may be. And so when I'm listening to, for example, medical students present in the outpatient setting, I feel like I've learned and kind of appreciated being really attentive to what they're saying, because it's kind of the joke that patients will bring something up to a medical student and are not an attending, or vice versa. And they kind of will, maybe give a different story as they maybe think about things, or based on, how the question's asked. And I've really learned to, pay attention and really focus on the history that our med students are giving us, because that may be something that I may not have gotten in talking with patients.
Now, specifically in adolescent medicine, it's probably likely that the medical students would be the closest in age to a lot of the patients that your team is seeing. So, talk more
Mhm.
about that dynamic.
Yeah, no, that's a really interesting dynamic, and I think too, it makes me think a little bit about why I got interested in adolescent medicine, because I think as a medical student learning about things that adolescents deal with, I was in my young 20s as a medical student. I really was within that adolescent age group. And I think that especially as the world has changed and the way we use science and technology and social media, being a teen now and an adolescent or young adult now, it's not the same as when I was an adolescent or young adult. And medical students who may be younger or kind of closer to that age range may have a different appreciation for things that patients are going through or dealing with.
Now, give some advice to the medical students who may be listening to you on this podcast, and they may feel exactly the way you did,
Mhm,
getting in the way, maybe some imposter syndrome,
mhm.
but give some perspective after reflecting about the role and the importance of the role that they're playing on the medical team.
So that's a great question. I think the main thing that I want medical students to take away from this, or really learners at any level, is that you are a valued member of the team and you can make a huge difference in a patient's experience. And that's a real privilege. And I think it's something that I would encourage people to not lose sight of. I, would encourage people to really get to know the patients that they're working with, and spend the time with them, because oftentimes that's the time of your training when you have the most freedom to really, get to know people and learn from their lived experience what living with a disease or condition may be like. And I think that's a really important part of learning that you can really maximize at this stage in your training.
Do you ever encounter patients or their families who are hesitant to talk to medical students, and they say things like, "I only want to talk to the doctor"?
Mhm. Yeah, I think that it's honestly more rare than I think, I anticipated as a medical student or as an attending. I haven't kind of come up with that as much. And I have gotten that in some situations. And I think, and this is in the literature too, that having medical students on a team actually can, lead to improved outcomes. And that's something that, obviously, we would respect the wishes of patients and their families if there's something that they're not comfortable with. But that's something that I always think of when I'm in those situations, how, medical students can impact care for the positive.
We're talking to Nicole Cifra. She's an adolescent medicine physician. Her KevinMD article is titled "The Surprising Impact of Medical Students on Patients." Nicole, tell us some of your take-home messages that you want to leave with the KevinMD audience.
Mhm. So, no matter what your role is on the team, you matter as a team member and you have something important to say. And thinking of, being a patient as well, you never know who you're going to connect with the most. And in a lot of cases, that may be an attending or a resident or a medical student. And I think at any stage in your clinical training or journey, you can have those really meaningful relationships, and they're so valuable and so meaningful to patients.
Nicole, thank you so much for sharing your time and perspective, and thanks again for coming on the show.
Thank you so much for having me.